Dean Galea Dr. Del Salvo, faculty, alumni, staff, family, and friends, a great morning to you all. And in Islam, we say Assalamu alaikum, which means peace be upon you. I am filled with gratitude and honor to be standing before you today and representing the class of 2018. I am even more honored because this is the month of Ramadan, which for Muslims is a blessed and holy month. So it is a reward to be able to share space with you today. Ramadan Mubarak to all of you who are observing. So let's talk public health. The first time I heard the term public health, I was in undergrad. I was sitting in my advisor's office trying to figure out what I was going to do in my life. And after, having some conversations with her, she said, "Why don't you do public health?" So I looked at her like, what do people in public health do? As you can imagine, and you probably already know, the words public and health aren't necessarily mesmerizing. So she said, I read an article about the intersectionality of health and religion, and it sounds like you, very holistic. She said, when you have a chance, look it up. I think you'll be great at it. So I'll have you know that by my senior year in undergrad, when everyone would ask me, what are you doing after you graduate? I said public health, still not having an idea of what it was. So when I finally felt comfortable and I felt like I knew public health, I decided to apply for graduate school. Boston University School of Public Health became my first school of choice. Like many of you, what attracted me to this school is our mission. The mission that says to improve the health of local, national, and international populations, particularly the disadvantaged, the underserved, and vulnerable. These words truly stuck out to me. So now let's talk about our time here. I'm sure many of us can remember the first time we sat in our core classes. It was like we were in high school all over again in our homeroom class. Some of us like the idea of being together in a cohort and working with the same people for the rest of the semester. And others, well, I'll just say if high school wasn't your thing, I'm sorry. I'm sure we can also remember the first time we talked about the socio-ecological model or the life course model, and these frameworks gave us an idea of how external and internal factors affect our health outcomes and behaviors. These frameworks also gave us an idea and had us talking about oppressive structures like racism and classism. And I tell you, when we had those conversations, they were uncomfortable. Some of us sat in the classroom like deer in headlights whenever we heard the term race. Others, we sat in the back waiting for somebody to say something wrong. And I must admit, that was usually me. And then there were some of you, the discomfort did not stop you from doing the work. It did not stop you from starting the conversation or joining the conversation. It did not stop you from taking action to actually dismantle these oppressive structures. As someone who was raised in a low-income neighborhood, who had friends whose families did not have the support or resources to live a healthy and happy life, I knew that these conversations weren't just theoretical conversations. These conversations were real. And sometimes what happens in the walls of academia is that we talk about things that many of us don't know. We talk about poverty not knowing what it feels like to go without a meal or not have a roof over our head. We talk about the deportation of immigrants not knowing what it feels like to have opportunity snatched from under your feet. We talk about gun violence, not knowing what it feels like to have to run and dodge bullets every single day of your life. We talk, And after we talk, we leave the classroom and the people who know what it feels like, who know what it feels like to be impoverished, who know what it feels like to be a child of an undocumented immigrant, who knows what it feels like to lose a friend to 20 bullets. So you see, these conversations are not just uncomfortable, but they're very painful. And while they're painful, they're also very important. And I know we will be having these conversations not only in the classroom, but also outside of the classroom. So we gotta get it right. If we're gonna have these conversations, we need to make sure that we're creating the intentional space to have productive, respectful, and most importantly, informed conversations. Because starting today, after we walk out of here, we're starting a new phase of our life. We will encounter racism, classism, xenophobia, and unfortunately, the list goes on. And it won't be a conversation this time. It won't be a critical thinking exercise. You will have to make the decision that will have an impact in someone's life, in their family's life, and in their community. Are you prepared? Okay. Because in those moments, we can't be uncomfortable. We can't be uncomfortable talking about the structures that affect the very populations we swore we would protect when we came in for orientation. We cannot be uncomfortable talking about the institutions we will work at when we said we wanted it to be more equitable. And I know sometimes we hear the words systems of oppression and we hear the term institutions and they sound immense. Other times untouchable, but I'm here to remind you that these systems of oppression that infiltrate our institutions can be dismantled. If there is anything I have learned during my time here, it's been taking a community organizing class at the School of Social Work. The main message was, there is power in numbers. When people show up, get together, and strategize, change can be made. And who right to lead the movement than us in public health? We who recognize the interconnectedness of health and how social factors determine our outcomes. We who know that unfortunately, someone's zip code is a better predictor than their genetic code. We who know that among those that are disproportionately affected simply because of the color of their skin, their socioeconomic status, their sexual orientation, and all these other factors that we as a society has created and termed different, and we cannot do that. We can only change the narrative by showing that we believe the work, the research, and the data that we produce. More importantly, we gotta act like our freedom is intimately linked. I am as a part of you as you are a part of me. And as my religious leader would say, we must exhaust all of our means when fighting for justice. So class of 2018, how will you show up? How will we do our work to make sure that each person in society has an opportunity to live their best life? As your colleague, I know you will do the work because I've seen what we're capable of. For example, a friend, Crystal Morieta, who spent her time here on campus, facilitating the Racial Justice Talking Circle. Or Brianna Chachere, an aspiring physician who has spent her time here bringing awareness to infant and maternity mortality rates that affect Black babies and Black mothers. Or Jillian Rossa, who has created a safe space for queer folks on and off campus. Among others, these movers and shakers have already begun doing the work. So I want to thank you all for what you have done. And I want to thank you in advance because I know that we will do good work. And I especially want to thank each and every one of you sitting here because I've had great conversations and become friends with so many of all. and I am up here because of you. To faculty and staff members who have had my back and been my support system since I've been here, specifically Candace, Lois, Judith, Mahogany, Adriana, Mary, thank you. To my friends from undergrad who go by the name Squad, and to my BUSPH gals, and to everyone else who I've broke bread with, thank you so much. To my family, thank you for loving and supporting me. To my siblings, thank you for always having my back and believing in me. To my nieces and younger cousins, thank you for always being my cheerleader. I want you to know that you deserve to live an amazing life, regardless of the color of your skin. I want you to feel that, and I want you to believe that. To my mom, dad, aunt, and uncle, thank you for never giving up. Thank you for coming to this country in hopes that your future generation would succeed. I hope that your dreams have come true hearing me speak today. And to the class of 2018, may the spirit of integrity, hope, perseverance, and love always be with us. May we hold ourselves accountable to what is right and to what is just. Whether we are sitting behind a computer analyzing numbers or on the ground providing support and information to community members, we must remember this. We have the power to make the impossible possible. Guests, class of 2018, it's been an honor. Thank you so much, and congratulations.